Hi, everybody. I'm Shruti Gurudanti. I am the co-founder of Televëda. Televëda is an award-winning platform of choice for some of the largest hospital systems and cities, helping them solve one of the biggest, most challenging public health crises we have today, social isolation. We have helped our partners engage thousands upon thousands of their members, and we've grown over 174% year over year in our member growth. And just to give you some context of scale and traction, in October of this year, together with our amazing partner Cigna, we brought together 125 plus centers from 26 plus states and about 10,000 people in person and online to play a very enthralling game, an engaging game of bingo. And we actually set a new Guinness World Record doing that. There is a huge demand amongst community health organizations to address social isolation because if it was a problem before, 56% of American older adults are reporting loneliness, and it's increasing their risk of mortality by 29%. And community health organizations are working very hard to create programs to engage adults, but they really lack the resources and the staffing need that is required to address this problem. And so that's where Televëda steps in. We are a platform solution, an end-to-end community engagement platform that helps community health organizations to very efficiently digitize and hybridize their programs and deliver it to folks in the comfort of their homes or wherever they are, helping them save time. And in the process, we have a social care network of programs that are created, and folks can supplement, the community health organizations can supplement their programs by drawing in from our network. So an example is now you have an older adult in Ohio participating in a Spanish-run support group by Banner Health here in Arizona, or a senior center in New York that is tapping into some of the programs that are being run by Kaiser Permanente in California. And it's helping them save about 25 hours per week of staff time when engaging adults. So how does all of this work? We have once a community health organization wants to work with us, they sign up and they get a fully white labeled platform that has various aspects of class management tools within it. And then they inform their members that now they have a hybrid virtual platform that their members can register onto. And then on the back end, all of our clients can look at very important metrics that they need to see, which is what is the traction, what is the kind of participation of members, how much time are they participating in classes, who has got left behind, and who is not participating and needs a little bit more TLC. Based on all of the traction we've had so far, we know that our platform is helping address social isolation because we built a proprietary platform, keeping two very important stakeholders in mind: the user, who is the older adult, and for them, we built a very easy to use, no username, password, one-click only platform that they can register and access classes on. And we have a recommendation engine that then, based on their behavior, tells them what classes or provides them with recommendation of what classes to attend. Now, the beauty about this is we have micro communities of older adults that have formed. We have a group of 80-year-olds playing, their own little book club. We have art groups, and in the process, that's helping alleviate isolation. On the other side, we have our stakeholder, which is the community health organization, and we very methodically and thoughtfully built a platform for them, which has all of the tools they need to scale various digital hybrid programs and all of the tools they need to get data analytics on, again, understanding how to improve the social engagement for each individual person, because now they can map the entire user journey of an individual who's part of the social engagement platform. Our business model is a B2B SaaS model, and we work with, when I say community health organizations, I mean hospital systems, adult daycare centers, and parks and recreation departments. We are expanding into with health plans, as you may have picked up, and the contract itself is an annual contract based on monthly subscription. This is a 10,000 people are turning 65 every single day. I think every one of my colleagues right now has talked about how huge this market is. But when it comes to social engagement, there is a huge amount of dollars that are being spent, close to 1.5 billion on just social engagement. And given the traction we've seen so far already and the demand that we have, we know that in the next 5 years, we can get 5% of that market. Our vision is to expand beyond the interest group and peer support groups that we have right now on the platform and become a 360-degree social care network where we can provide virtual care, virtual coaching, also companionship possibilities for adults so that they have the entire spectrum of needs taken care of when it comes to isolation or loneliness. This is the dream team that we put together to make this happen. Collectively, we have over 10 years of experience in having built companies, sold companies in healthcare, policy, and engineering. Right now, I guess our ask is that in January, we're going to be doing our very quick round of our very quick seed round. We already have a lot of interest from our existing clients who have venture arms. So I would love to talk to anyone who is interested in this space as a health tech investor and would want to support us in this mission of helping alleviate social isolation and loneliness.
Thanks, Shruti. Great presentation. Why don't you tell us just a little bit more about that round that you're planning? How much are you looking to raise? And are there any specific types of investors that you're seeking, since it sounds like you've got some soft commitments already?
Yes, so this is in January, we'll be doing our seed round. We've been 100% bootstrapped so far, but of course we have Startup Health as an investor. And in January, we'll be, it's a $1.5 million round that we will be doing, and it'll be fairly quick. So yeah.
Great. I really love the community and the platform that you're building. I feel like I could use some chair yoga right now after sitting here. It's such a great opportunity once you get so many people engaged and on your platform and building this community, even beyond loneliness and isolation. Have you thought of other ways that you can leverage the newly formed communities, like education or volunteerism or things like that?
Yeah, absolutely. So right now, our customers have a reach of over 500,000 people in their network. And so we are rapidly expanding that outside of the older adult market as well. So now we're also catering to kids and kids with special needs and folks of across all age demographics. What's wonderful is by working with cities, we're also cross-pollinating into some of their other departments. So outside of just senior centers or recreation centers, we're now also working with the economic development teams to try to bring in some of the programs that they're doing from a entrepreneurship perspective of how to leverage, what are the programs that are going on at the university or local schools to help educate the population. So we're expanding pretty well into some of these other age demographics and other sort of context pools as well, content pools.
That's awesome. Sounds like there's just so much opportunity for you to explore as you scale. What do you say to people that would say, well, what about groups like Facebook that are already building natural community? What gaps are you filling? I can already guess on, the different constituents that you're pulling in, but how do you address questions related to that?
Yeah, so we don't want to be a Facebook. I would argue that Facebook is building a toxic kind of community where the metric is more based on how long are you on the platform and what that engagement looks like. For us, we're more focused on meaningful interactions. And that meaningful interaction for somebody could be 30 minutes or half an hour or like an hour, but it is meaningful to them in a way that they formed a friendship or some sort of a bond. And that's the kind of engagement that we're optimizing for. And that's why our micro communities are so beautiful, that when based on our recommendation engine, when they see that these are the programs that are most suited for their skill set or the things that they're looking for, they're now able to meet a core group of people who actually have that specific interest that they have, and they're engaging with them in real time, and it's live. It's all interactive. It's not just a post that they're leaving on Facebook. But again, it's more meaningful in the context of they're meeting people who are like-minded and in a period of time that's really meant for engaging them, again, based around the interests that they have.